Hello, I'm Celeste. I am a special needs teacher, autism advisor, and a parent coach for Olive Tree Neurodiversity. And today I'm going to talk to you about autism. We often get parents who come to us and ask about specific behaviour difficulties that their children show and want to know if it could be signs of autism. So I thought this is a very important question that we need to address. Today I'll be talking about some different signs that children might show when they have got autism at different ages. I'll be talking about how autism can be different between boys and girls, and I will also be talking about the different terms that we use sometimes, high functioning, low functioning, Asperger's, and talking about what those different terms might mean and how they're interpreted. So stick around if you'd like to find out a little bit more about how we can see the different signs of autism in children. One thing just to clear up right at the start is that I am not an educational psychologist. I cannot diagnose any children with autism. I merely support children with autism and support parents to help support the children as well. So I can help you look out for specific signs, but I cannot diagnose whether your child has got autism or does not. Also, some of the signs that I'll be talking about today could be present in some people with autism, but not every person with autism will show exactly the same sign. Autism isn't linear. It's not something that is black and white. You have it, you don't have it. If you have all of these things, you definitely have it. If you don't have any of these, then you definitely don't have it. It doesn't work like that. It is a spectrum. So it used to be seen as a spectrum where you're either a little bit autistic or very autistic, but that view has been rejected completely, because that is not how autism works. It is more like a wheel of autism, and you can be different high functioning or low functioning, or experience these symptoms higher or to a lower degree, and it can be different in each segment. So some people might have a really big difficulty with communication, but not a big difficulty at all when it comes to sensory difficulties. It could be completely different. So here are some examples of how different autism spectrums might present, how different people could experience these difficulties. Okay, so ASD stands for Autism Spectrum Disorder. It can be classified as high functioning or low functioning. Those terms are widely not really accepted by the autistic community, and that's merely for the fact that they can be very deceiving. Saying that somebody has got high functioning autism often makes it sound like they can function absolutely fine, and that is not necessarily the case. It is merely a kind of an indication of how well they are functioning academically. So if academically they are doing really well in school, in English, in maths, scoring really high in tests, and they are seen as high functioning. But a lot of those children can have real difficulties with social development, with emotional regulation, with sensory needs, and they could actually be having an incredibly tough time and really struggle to get through the day. But because their academic side looks high, they are seen as they're okay, they're high functioning, and we don't really see the difficulties that they are dealing with every day. So just keep that in mind, that just because somebody is described as high functioning autism doesn't mean that everything's okay for them. Similarly with low functioning autism, that doesn't necessarily tell you that they are not intelligent. It just tells you that academically they are struggling, and that concepts to do with the maths and English sometimes could be harder for them, and also that their language sometimes can be an issue as well. So these are typically children who would learn language later on. They would start speaking later. Usually a child would already by the age of 2 be able to do some short phrases, have quite a good vocabulary, but children who fall within the low functioning side of autism usually would maybe sometimes by the age of 3 or 4 not really have many words at all. They can be seen as pre-verbal or non-verbal at that age, up to 5 or 6 if they haven't got the right interventions in place. Okay, so that tells us a little bit about high functioning and low functioning in those terms, and as I say, they can be kind of confusing sometimes as well. In the past, they used to use the term Asperger's syndrome as well to describe students who have got the high academic level, but that is now part of the whole autism diagnosis. It's not seen as a separate diagnosis anymore. So somebody who is functioning really high academically, who would have been seen as having Asperger's in the past, now would just fall under high functioning autism. Okay, so what does autism look like in children? The way that autism presents in children can vary completely depending on the age of the child, but also because it just looks different in different children. It is going to present individual to each child. Okay, so usually signs that a child might have autism, and again, please take this with a pinch of salt because not all children present the same, and there could be different difficulties that also look similar to the things I'm describing now. So usually if a child have autism, and I'm now not talking about the side that are really high functioning, that language would not necessarily be an issue. But for the biggest thing that people usually see is when a child is supposed to start talking around 1.5, start saying some words and making some little phrases, that parents would notice that their little child is not yet talking, and that they might not necessarily be trying to get the adult's attention so much. And usually eye contact is a big thing as well that parents notice. So I'm calling my child, I'm making faces, I'm babbling to them, and I'm tickling them and things, but they are not actually showing me any interest. They're not making eye contact, or they are looking past me, or they're looking to the side, or they are just very fixated by something else in the environment, whether it's a spinning fan, whether it's a light, whether it's their own little fingers. So it could be other things in the environment that to them is perceived as more interesting than a parent's face. So that could be one of the things to look out for. And as they get a little bit older, these things might become a little bit more noticeable. So now if a child is already 3 years old and still not really talking, or they might have a few words, but those words are mainly used to name the things that they want. So for example, they might know that the word milk, and use that milk when they want something. But if you ask them, for example, would you like some milk or juice or water, that they don't really have that understanding that I can use it to make choices, or that I can use language in conversation. Or if you ask me, what would you like to play with, that they don't necessarily understand those questions. So they could name specific things when they want those things, but if you were asking them, where is your train, that they look at you with a blank face because they don't understand the question. Okay, so the language becomes more of I would say, more of an issue really as they get older. But equally, children might find ways to communicate to you still if they haven't got any words. So it might be that they are pulling you to the things that they want. Instead of saying to you, I want an apple, they might be pulling your hand up to the bowl of the apple, or taking your hand and putting it on the thing that they really want. And that is a way that they are telling you what they need, but they are not using their words. So again, that could be an early sign of autism, or it could also be that it's a language delay. So it might not necessarily be autism. It could be more of a language delay. Okay. So some of the other signs to look out for is sensory difficulties. Children could either be sensory seeking or sensory avoidant. So sensory seeking, for example, would be putting a lot of things in their mouth, because this is one of the biggest areas of sensory information gathering for a young child. So they might be putting things in their mouth a lot of the time. They might be liking different textures to touch, or love lots of messy things. If they're sensory avoidant, it's obviously the opposite. So they would avoid touching anything that's messy. They would avoid, for example, food where there's sauces on, and they don't like the fact that the sauces could get on their hands, or the feel of it in their mouths. Again, it's the sensory. It's not necessarily to do with the taste, but it's more it feels messy in their mouth. If a child's not willing to touch something, they very, very rarely will put it in their mouth to eat it. So bear that in mind when it comes to feeding difficulties. So sensory things as well could be with their ears, for example, that they either love listening to specific noises, or that they cover their ears whenever there is a loud noise. Things like this could be hair dryers, hoovers, drying hands in restrooms, things like that could be really, really difficult and distressing for children. And it's worth noting at this point that these kind of things are not just things that they don't like. It could be that it's actually things that are really painful to them, because they experience sensory information in a different way. It's a sensory processing difficulty. Okay, so the way the brain perceives that information could actually be really, really uncomfortable for them. So we don't just want to get them used to it. We want to make sure that we adapt the environment a little bit, because this could be something that is really causing them distress and could lead to a lot of behavior difficulties as well. So we've talked about the language, we've talked about eye contact, we've talked about sensory needs, and eye contact is actually one of the sensory things, that it's just providing them with visual information that is quite difficult for them to process. Eye contact could feel uncomfortable to a child with autism, not all of them, of course. And then Also, we have got some rigidity in how they do tasks, for example, or how they expect things to be in order. So this relates to routine. It relates to how they want their environment presented, really. So it could be that a child likes to line things up because to them it makes more sense when they are in that pattern that they prefer. So it could be by color, it could be by size, it could be that it's just their favorite to their least favorite. So they often quite like lining things up, having things very precise. If it's an older child, it could be that it's, their desks are very neat and all of the pencils are in this pot and all of the hairbands are in that pot. And obviously a lot of children are just really neat, and that doesn't mean that they have got autism difficulties. However, when a child has autism, these are kind of taken to the extreme. So if they have got their desk really nice and tidy and you move something, it might make them feel quite upset or dysregulated that actually now something isn't in the right place and they have to fix that first. They can't kind of stand it being out of place. Okay, so that's where the difference comes in. A child who is just neat would be okay with it being messy for a little bit and then tidy it later, whereas a child who has got a real difficulty with that routine and order would find that quite difficult. Again, with routines, things like predictability, so knowing that exactly what happens at what time or on which days, and knowing what the plan is for the day. Kids will often ask their parents, what's the plan? What are we going to do? What are we going to do next? When are we going to do this? When are we going to? And it's quite repetitive. So it might seem that they're kind of stuck in a loop and they keep asking you over and over the same questions. When will we go? When will we go? Are we going to grandma's house? Are we going to grandma's house? Because they can't see it visually. So those kids often struggle to understand the concept of time, and therefore they want those reassurances every so often. So they'd like to know exactly when something's happening, how long will it be for example, how long will they have to wait. If you tell them, I'll come and help you in a little bit, that doesn't really mean anything to them. Can you give them a more precise time? They really usually benefit from having something like a visual timetable that can explain the order of things that will happen in the day, or a calendar that can show, if they can understand that concept, if they're a little bit older, a calendar to show them that, this is the days we're going to school, and then we, on the Thursday and the Friday and the Saturday, we will be home, or we will be at swimming on this day, we will be visiting somebody on that day, and they can prepare themselves for those changes. And for the very young children, it can really be a difficulty for them to transition from one activity to another activity. So if they're busy playing with their favorite toys, for example, and you say to them, right, we need to finish now because it is bath time or it is bedtime or we need to go and have our dinner, and they could often have quite big meltdowns because it's really difficult for them to transition from one activity to another. They want to finish the thing that they're busy with. So if they, for example, like lining things up or building a puzzle or packing out the ABCs, and in the middle of that you interrupt them to say, actually we need to stop now, that could lead to a really big behavior meltdown, as we say, because they want to finish it and their emotions can't regulate through that thing that they really want to do, and they are now being stopped from doing that. So that could be another sign that a child might struggle with some of these difficulties. Okay. A lot of toddlers have tantrums, so don't confuse the fact that if a child has a tantrum, that doesn't mean that they have autism. Almost every toddler goes through a tantrum stage, and that is completely fine and age appropriate. It's how they learn to work through those and the things that's causing them tantrums. Usually after a couple of years they grow out of that, and the things that are causing them tantrums are just the everyday kind of thing. I want something, I can't have it. Whereas with a child with autism, it's more specific to do with either a sensory overload, or it could be to do with an activity that they feel they have to finish and they can't understand when you're trying to explain to them, we will finish it a little bit later, or we'll come back to it when we come back. Okay, so those are some of the things to look out for really young children, but also when they're starting school age, that could be some of the things to look out for as well. Okay, now another thing that I want to mention is specifically about how boys and girls differ when it comes to the autism spectrum difficulties. Usually, and again, it doesn't happen with every child the same, but usually girls are more social. So specifically when they have got some language skills, in school you will find that girls want to fit in and they want to be part of the group, and they want to feel like they belong with the other girls. So a girl with autism might feel that they don't belong, and they might feel, I'm different from my friends and I've got different interests, but they still want to be part of the group. And quite often girls with autism get undiagnosed. They go undiagnosed for years sometimes, because teachers see, but they're always part of the group. They've got friends. It's fine, you know, that we would see if they were all alone, or if they were feeling isolated, or if they had poor social skills, but actually they're just part of the group and they have their friends. So it's easy to overlook those difficulties. And because these girls learn how to copy others very quickly. So, for example, they might see that girls like to give lots of hugs, so they give lots of hugs as well, even though it's not something that they really enjoy doing. And they might see that girls like to talk about a specific topic, so they will also join in and talk about that topic, even if it is something that they don't really find interesting. When it comes to social games, they will try to join in with the social games because they want to be part of the group, but sometimes they might misunderstand the rules, or not really understand the whole concept of what's going on, and therefore get a little bit left out, or feel like they're always losing in the game. Equally, they might misunderstand things like humour and sarcasm. So sometimes somebody might be actually quite rude to them, and they think they're making a joke and laugh at it and think it's fine, that, you know, they were just joking, when actually somebody was actually being rude. Or the opposite, that they perceive a comment that a friend says as being rude to them, when they were just making a joke, or just being sarcastic, for example. It's something that's quite hard for them to understand, so they have a very literal understanding of language. Boys do as well, but as I say, with girls it's sometimes harder because they are in social groups often, and you don't see that they are feeling a little bit isolated. Another thing could be that they like to laugh when the rest are laughing, but they might not necessarily understand the joke. Okay, so it is harder to spot when girls struggle with this, but it could be more because you see that the girl, for example, complains that other people are being rude to her, or that they change friends quite often and they don't stick with the same friend for very long, because of those kind of misunderstandings, and feeling like they don't belong, so they kind of move to a new group and try there, and then move to a new group. So that could be a little indicator. Also, then what often happens with these girls is that at school it looks like everything's fine because they've learned these coping strategies, and they've learned to blend in and to look like they are fine and look like they're coping, because they know if I scream in frustration, I'm going to look odd. If I tiptoe around the classroom, I'm going to look odd. So they suppress those feelings that they actually have. And then when they get home, they have these really big burnouts, like emotional overload, and they might have just a complete meltdown at home and just slam the door and go into the room and not wanting to talk to anybody, or being argumentative with parents or siblings, or even sometimes aggressive, breaking things in the house. It could be quite extreme, because these girls are suppressing their kind of natural instincts all day at school, because they want to fit in, and it's called social masking. So a lot of girls on the spectrum, some boys as well. So it's not only girls that do this, but that is something to look out for as well. If the school's saying everything is fine, but you're having really big difficulties at home, that could be what is happening, that they're actually masking at school. Okay, so I think one of the biggest things to look out for, if you are looking for just a shortcut of, you know, what symptoms to look out for if a child might possibly be on the spectrum. The first thing I would say is check for any sensory difficulties. Is there anything that they completely avoid, or that they are craving? So a lot of jumping movement, and for example, could be that they're craving that movement sense. Proprioception or vestibular is one of the senses that they could be craving. So big sensory difficulties could be one indicator. Language could be another indicator. Eye contact could be an indicator. Their rigidity, or where they need a specific pattern or predictableness to their day. And then also obviously there's social difficulties as well, in terms of how they are seeking interactions from others, or just joining in with social situations. Okay, those are the main difficulties that a child with autism could face. Right, if you have any questions, or if you think that your child might have autism difficulties, feel free to get in touch with Olive Tree Neurodiversity, and we can talk you through in a free consultation, and provide some support for you or your child. You can also, I would recommend that you speak to your GP and share your concerns with them, and speak to your child's school if they are of school age. If they are younger than school age, you could speak to the health visitor and share your concerns with them. To go through the process of autism diagnosis is actually a very lengthy process in the UK, it can take several months to longer than a year in some cases. It involves a multidisciplinary team, so it won't just be one person that assesses whether your child does or don't have autism, because there are so many different difficulties to look out for, and they need to make sure that it's not something else that's just presenting as autism. So they will, for example, offer parenting courses, and they will have speech and language therapists, a pediatric doctor, they will have psychologists there, they will have occupational therapists, and the whole team of people will have a look at all of the difficulties that your child may face, and then decide whether they feel an autism diagnosis is appropriate or not. In the UK, you can also, if a child does have autism or present with some severe difficulties that are difficult to deal with in school, for example, so you might feel like the school's not meeting the needs of the child, you could apply for education, health and care plan, which could put some provision in place that the school has to meet as a statutory requirement. So it's a legally binding document that goes with your child through school until the age of 25, and it is reviewed annually. Okay, if you've got any questions about anything we've talked about today, or want to share some comments, please feel free to get in touch. Thank you. Bye.